It's a sound Denise Bulpitt spent years wishing she could silence.
One of my biggest fears was, am I going to be able to beat the clock and prevent breast cancer before I get it?
She fought and won against stage 1 ovarian cancer in 2014. Then a year ago, she lost her breasts. But that was by choice.
After I had recovered from chemotherapy, I pursued having a double preventative mastectomy, which I went through last November. And it was scary, but on the other hand, it probably prevented me from dying young.
1 in 8 women in the United States will develop invasive breast cancer. Bulpitt's chance was about 6 times higher. Genetic testing at UT Southwestern Medical Center revealed she and several of her relatives inherited a harmful mutation known as BRCA1 or BRCA1. Because of that testing, doctors caught one cancer early and reduced her chances of more cancers forming.
How fabulous that we have the knowledge to do that now. I mean, I'm sure that my aunts who died at 40 and 33 and my grandmother who died at 42 would have loved to have had that information and been able to act before they died of cancer early.
There are some mutations that put you at high enough risk that you can take action that can save your life.
Dr. Theo Ross, a scientist and oncologist, doesn't just lead UT Southwestern's program for cancer genetics, it's part of her life story.
My sister had breast cancer at 35. She died of breast cancer at 38.
Ross later discovered she herself is BRCA1 positive. Her own predisposition to breast and ovarian cancer led her to also have a double mastectomy and her ovaries removed.
But I think when it comes to health, it's important to face the truth.
She spends a great deal of time with her lab doing basic research needed to understand how mutant cancer cells turn normal cells into cancer cells. She's also focused a lot of attention on helping people like Bulpitt get genetic testing, interpreting their results, and navigating through the next steps.
Recently, we've started an initiative where we have a genetic navigator who will call the patients that have a mutation and say, hey, what have you done? Do you need any help? Can I help you communicate with your family members?
Another team of researchers at UT Southwestern is also encouraging people to keep family history top of mind. They recently found out that women are often unaware of ancestry that could influence the risk of cancer, particularly triple-negative breast cancer. That's one of the most aggressive forms that shows up more often in young African American and Hispanic women. Results from a 3-year study were just published in the journal Cancer. Nearly 15% of study participants didn't realize their ancestry put them at risk.
You really don't want to think about it. You kind of keep hoping that maybe it won't be you.
Knowing, your genetic inheritance, knowing your family history, it's a very important part of this equation.
Which is why she and Bulpitt are sharing their genetic testing journeys, hoping others follow their lead and keep life ticking as long as possible.
Now I have gone through the process of having breast reconstruction and am back to work living a normal life, and that is fantastic.